Bemotrizinol is a new sunscreen ingredient that was recently FDA approved. It has excellent protection against the UVA light spectrum. So UVB causes sunburns, and UVA goes a little bit deeper and can still damage the skin, can still cause skin cancer. So excellent UVA protection, and it's been approved in Europe for over 20 years and just coming to the United States as a exciting new ingredient. We have two different types of sunscreen. So there's chemical-based sunscreen and mineral-based sunscreen. So mineral is your titanium dioxide and zinc oxide. Chemical gets a little bit of a bad rap recently because of the benzenes. So oxybenzone has been removed from sunscreens, but it is a good blocker against UVB radiation. Bemotrizinol offers excellent protection against broad spectrum, so UVA and UVB. And in the studies, it does not get absorbed systemically and has not shown to cause any issues in animal studies. UVA coverage matters, especially in patients who have had a history of skin cancer. It plays a lot of role in photoaging, so wrinkling of the skin. It's really important to choose a broad spectrum sunscreen that covers both UVA and UVB radiation. Bemotrizinol offers excellent UVA protection, where our current sunscreens fall a little bit short in that regard. It doesn't generally leave a white cast. The white casts are traditionally attributed to our physical blockers. So the zinc oxide, titanium dioxide are physical blockers that block all rays. Those are the ones that typically leave your white cast. The Bemotrizinol, at least in the European formulations, has not left as significant of any white cast. I would recommend, though, for the best coverage to actually use both mineral and a chemical-based sunscreen. So something with Bemotrizinol and a mineral like zinc oxide, titanium dioxide. However, our formulations now have become really advanced, where there's minimal white casting. A lot of these options are tinted, which gives even better protection and less of those cosmetic concerns. The FDA is obviously very strict in their guidelines for approving any new products in sunscreen or otherwise here in the United States. In Europe and Australia, Asia, other countries, the guidelines are not quite as regulated, and sunscreen is considered an over-the-counter product in those other countries. So it's definitely exciting to have something that can offer a lot more coverage and protection. And with the recent news with the benzene-containing products like oxybenzone that was traditionally found in our US chemical sunscreens, it's exciting to have something that is viewed as safer and studied as safer. So hopefully that'll encourage more patients to use sunscreen regularly. The FDA has very strict regulations. It does matter clinically. When they did the studies, the animal studies, again, there was less absorption systemically, and even at very, very high doses in animal studies and rat studies, there were no negative consequences from that. And in general, even with oxybenzone and other chemical sunscreen ingredients, you'd really have to be using quite a bit super frequently to get any systemic absorption. Most Americans, most people are not putting on sunscreen as they should anyways. It should be a shot glass applied every 2 hours. Most patients aren't doing that anyways, but it is nice to have a new product that was studied and did not show any harmful effects. I think that it'll probably be slowly incorporated. I would say I'm always going to encourage what is approved by the FDA because we're in the United States and that's what's safe. But for patients who are already using European sunscreens, I'm sure they can continue with those sunscreens. And then as the rollout starts here in the United States, patients can consider switching to get more UVA protection, which would be, again, especially important in patients with a history of several skin cancers, patients with lupus, patients with other photosensitive conditions or dermatoses that really need very broad coverage. Again, it has broad spectrum coverage against UVA and UVB, so it could stand on its own. My thought is that it would be most likely combined with other ingredients. Our traditional oxybenzone and chemical sunscreens here in the United States do need stabilizers because they degrade upon sun exposure, and that's how they get systemically absorbed, whereas the Bemotrizinol does not need those stabilizers, so it can stand on its own. Patients with melasma would want broad spectrum UVA coverage. Darker skin tones who are more prone to hyperpigmentation may want to consider switching to Bemotrizinol. And then again, anyone with photosensitive conditions like lupus or other photodermatoses may want to consider switching to Bemotrizinol as well. I would recommend it. However, I also feel like the very best sunscreen is whatever the patient is going to use consistently and appropriately. So again, reapplication of sunscreen every 2 hours when you're outside, you're sweating, you're swimming, you're in that intense sun, practicing sun avoidance. But again, whatever the patient is going to use correctly and consistently is what I will recommend. If they're looking for guidance and they want better protection, then I recommend switching to something with Bemotrizinol. But if they're already using something consistently that they like, they can stick with that. Frequent reapplication, wearing it, using something with broad spectrum coverage, both chemical and mineral to give you the best coverage. Even tinted is even better because it contains iron oxide, so that's protecting against the visible light spectrum as well.